Hello. So today we are going to be discussing hypertension, and this is basically high blood pressure, and it occurs when your blood is pushing too forcefully against your arteries. All right. So this is measured in millimeters of mercury, and mostly it's written like that. mmGh. Yeah. And it's taken in two numbers. Like this is the top number, then over a bottom number. So the top number is the systolic, and this is mostly when your heart contracts. Okay, when your heart muscles contract, this is to push out blood out of the heart. And then the diastolic is the bottom number, and this number, the diastolic is when your heart is relaxing to fill up with blood. All right. So normal blood pressure is 120/80. So if your blood pressure is reading 130/80 and above, then that is high BP. Okay. Somebody is probably out there saying, "Oh, I had a blood pressure of 135/80. Oh, now Pamela, I think I'm hypertensive." No, 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 no. We need these readings in more than two readings in 2 or 3 different occasions for us to say that now you have hypertension. You can't just do it on a single reading. In fact, we would love to see like you home monitoring, you doing more home monitoring for 3 to 7 days, and then we can see how that is. Or going to the hospital and having these readings for 3 to 7 days, and then we can probably see the trend. Because some other times you could be anxious about something, you could be stressed about something, and maybe now, or you could be in pain now. Maybe now this isolates the BP. It's quite high, unless you come in and the blood pressure is 180/120. Oh, then we're not only having high blood pressure or hypertension, now we're having a crisis. Okay, otherwise, not just one reading, guys. Okay, you can't diagnose hypertension on just one reading. We're gonna get into that when you're looking at the diagnosis. That will be really quick. So let's just dive into the types of hypertension. Okay, so we have primary hypertension and we have secondary hypertension. Now, primary hypertension, these are the causes that are within you. Okay, your age. People are even getting hypertension from the ages of 30 going up. It's crazy, right? But then the age factor is also attributed to genetics. Do you have in your family tree, do you have people that have been hypertensive? Especially if these people are your immediate family members. For example, your parents, they are hypertensive, then you're likely to get that. Going to secondary hypertension, this type of hypertension, it has an identifiable cause. All right. For example, you have an underlying disease such as diabetes. Most patients with diabetes subsequently get hypertension because of the damage of the arteries. Okay, then again, maybe you have a thyroid issue. This can subsequently lead to hypertension. Maybe you're pregnant. Most people don't know this, but sometimes pregnancy is a disease. That's why you're supposed to respect a pregnant person. Yeah. You know what I'm saying. So if you're pregnant, sometimes you're likely to get hypertension. It's called gestational hypertension. So now you have an identifiable cause. Maybe you're using hard drugs, for example, nicotine, cocaine, all these things. These are identifiable causes. So now these cause secondary hypertension. So for the signs and symptoms of hypertension, so this is where now it's getting interesting. These ones, you might not even see them, okay? Because sometimes it comes in as asymptomatic, but then when your blood pressure is being taken, it is actually high. And when you look at it, it's not about anxiety, it's not anything. Then the diagnosis comes in. Now that's why it is very important for you to go for screening of hypertension. And just go and get your vitals monitored at least every month. Go to the hospital, say you just want to have your vitals taken, have your BP taken, have your pulse rate taken, your SpO2 taken, your temperatures, your weight. It's good, by the way, to do that. Have it done routinely, because these things are actually sometimes asymptomatic. Now, Otherwise, if the symptoms come, they're gonna come as headache, and mostly you're going to take medications for headache, thinking, hey, I'm just having a headache, let me just take medication. So you just go over the counter, grab some medicine, and then you take it. Yeah, and you do this constantly. Besides that, another sign is eye pain. You start having visual issues like eye pain, blurry vision. These are the most common signs and symptoms of hypertension. Now you see how dangerous it is, because you're likely to think, I'm just tired, or I'm just having eye problems. It doesn't click that this could be the issue. No, the worst thing about it is that by the time you're coming to get diagnosed, sometimes people walk in, as I said earlier, you can walk in, actually exhibiting signs of stroke. Yeah, this is when your BPs now are reading 180 over 120. It's up, it's like it's over the roof. Okay, by the time you're coming in now, the vision is so bad you can't see. You're having these serious palpitations. You're having slurred speech. By the way, if you know somebody that is actually hypertensive, and you start seeing them like they're having slurred speech, the drooping of the mouth, they're having some weakness, you're just speaking to them and suddenly you realize that, please rush them into the hospital. That is a sign of stroke, otherwise known as CVA. Okay. Besides that, conversions, by the time you're getting to the hospital, now this is something else. So it is actually very important to have, please let me repeat that again. I know I'm going to be repeating myself in the video when I say this, but please, at least every month, check your vitals. All right. So what are the risk factors to hypertension? The most common one, the most obvious one, age. Okay, we're talking about age, whereby if you're 55 years and above, you're likely to get hypertension. But again, it doesn't mean that you have to be 55 years and above to be hypertensive. Why? Because you could have family history. Now, family history is among the most top contributing factors. Your family tree, your genetics, you could be predisposed to this because of your family. So that is another risk factor. Another thing is being overweight or being obese. So please, it's good to stay fit, it's good to exercise so that we are not predisposed to getting hypertension. Again, the kind of diet we are taking. So of course, if you're watching our weight, then it comes down to what we are eating. So foods rich in sodium, they're predisposing you into hypertension. Sodium is basically salt, guys. Too much salt, you buy some fries, these fries do not have enough salt, let me just add. You buy a lot of, you're using a lot of fat, there's a lot of cholesterol. It's going to clog your arteries. It's going to increase the force of the blood through your arteries, subsequently leading to, you got it, hypertension. Oh, and also smoking tobacco, guys, and also using drugs. In fact, even alcohol in its excess. That's why they say moderate consumption of these things. Yeah. These are all predisposing factors. These are all risk factors for you to getting hypertension. Okay. So let's look at the complications of hypertension. The first one is CKD. This is chronic kidney disease. Your kidneys are going to be affected in the long run if you get hypertension and it's not well controlled. So it's good, even if you get diagnosed, it's not the end of the road. Just have the blood pressure controlled so that you don't develop these complications. All right. The other one, one of the other complications is could have heart issues. These heart issues include issues like atrial fibrillation. This is where your heart rhythm is all over the place. You could have coronary artery disease, could have heart failure, this peripheral arterial disease, for men, erectile dysfunction. So these are gonna happen if you're not diagnosed early enough. Sometimes you can even come in as you're diagnosed. This is also happening. But as I'm saying, this is not the end of the road, guys. Like if you get yourself into that, there's always things that can be done. There's dialysis options, sometimes hydration, sometimes with better control of the blood pressure, Some things can be reversed while others cannot, but all of these things, we can work on them. Okay. So as I was saying before, let's talk about diagnosis. These figures are going to be a little bit tight, but I'm just going to be writing everything down on the side so that we get and we are all together. So diagnosis is made in categories. Okay, so the first category, it's almost normal, but not normal, nothing alarming about it. This is category A, where it's elevated BP. We have the blood pressure of 120 to 129, but the diastolic, the bottom number is 80. Here we are okay. Now, the second category, this is called stage 1 hypertension. Now, in this category, the blood pressure is 130 to 139. That is a systolic, the top number. And then the diastolic, the blood pressure is 80 to 89, okay? Then you go to another category called stage 2. This is where the blood pressure is 140 over 90 and above, all right? Now we have another category that is called, severe hypertension. There's a blood pressure of 180 over 120. You could have a patient coming in, they have a blood pressure of 120, over 180 over 120, but, they are not symptomatic. They do not have the headaches, the blood pressure is that high, but they're not symptomatic of anything. Now we have hypertensive urgency, emergency hypertension, hypertension crisis, all these three terms are used to describe a blood pressure of 180 over 120 with symptoms. Now, these are the people that have come in, they are having these headaches, they're having palpitations, they are having chest pains, they are symptomatic of this high blood pressure. They are at a very high risk of getting into CVA. All right? So this marks the end of my video, guys. I hope to see you in my next video, where we're going to be talking about medications that are used in hypertension, especially for the students in nursing school. That video is going to be very beneficial for you. Please stick around, because we're going to be looking at the classes, what to look out for, how to, different contraindications and interactions of these drugs, and very frequent asked questions in exams. I hope to see you then. Until then, please have a good time.